After the deadly earthquake struck southwestern China in 2008, I traveled there to be a part of the emergency relief effort. I was overwhelmed by the suffering that I saw. The earthquake led to the loss of over 70,000 lives and the displacement of over 40 million people. Amidst this chaos, there was close coordination of the multiple groups there and an overall organized response. For instance, I took part in a large-scale assembly line where we assembled, packaged, and distributed essential items. Being China, essential items included chopsticks and white rice, of course. When I returned back to Boston, I realized I was faced with yet another emergency, this time in my own primary care clinic. We were tackling an epidemic of diabetes and chronic disease. And although much slower moving, this emergency was no less deadly. And unlike the emergency response in a disaster area, we didn't have the coordinated care teams that we had on the other side of the country and on the world. There are over 3,000 diabetic patients at the Phyllis Gen Center for Primary Care at Brigham and Women's Hospital. I see our patients struggle with checking their finger sticks. I see preventable complications such as amputations, blindness, and kidney failure. There are over 25 million diabetics in this country alone, and we are not doing what we should be to take care of these patients. Part of the problem is diabetes is very complex. It needs the multiple disciplines working together, and it requires close coordination and communication with patients. And even though there's lots of people involved and multiple systems in place, we're lacking tools for coordination, and our care is not as patient-centered as it could be. Many people are involved in the care of a patient with diabetes. In addition to their primary care doctor, they could be seeing an endocrinologist, a nutritionist, a social worker, and a pharmacist. Ideally, all of these providers are working together to take care of their shared patients. But as you can see from these multiple lines, there are opportunities for care to fall through the cracks. Studies show that the bigger the team, the more difficult it is to coordinate. It can be very confusing for patients to navigate the system, especially when there's multiple providers. Here is the words of one of our patients.
I see two cardiologists and primary doctor, Bill the nurse, and neurology. And I go to therapy too sometimes. It's all Brigham and Women's Hospital.
Our patients are not the only victims to the confusion. Here are some thoughts from some of my care team members, including one of our primary care doctors and one of our social workers.
We are inundated with emails and phone calls, and we easily lose sight of tasks. It is really hard to track down people to coordinate, and time is limited.
Right now, there's just no place for care team members to engage about a patient's care.
So what could help solve this problem? In order to figure it out, we took all the people involved in that chaotic structure you saw before, and we formed a task force. This multidisciplinary task force came together and came up with the idea that it could be very helpful to have a workspace where everybody could coordinate around a patient's care. This workspace, which we called a care plan, was a place where we could gather all the important information about a patient, such as what are their support networks, what is their language of preference, what are their goals, and team members could write in how they each were contributing to the patient's plan. There could be a place where they could communicate, they could assign tasks, and they can give each other updates. But most importantly, the patient is at the center of our care plan. There's a place for goals, which the patients and doctors come together to meet, is placed in the care plan, and they use goal-setting documents, which are picture-based, colorful, such as this, to spark the conversation of what's most important to the patients, be that exercise, smoking, or any other goal that's important to them. We've now tried out early versions of this care plan and have only just begun to see the full potential. Let me give you an example of how it works. A patient named Sylvia came to our clinic, and she wanted to see her primary care doctor. While she was checking in, a medical assistant helped her fill out the goal-setting document. Sylvia said that she wanted help with improving her diet. So she brought this sheet in to her patient visit, and her primary care doctor came up with the next step for reaching this goal. Sylvia was going to try to eat more fruits and vegetables. You see how this is then put into her care plan, and her primary care doctor was able to refer her to nutrition to help her with this goal. The doctor then talked with one of our excellent care management nurses, Bill, seen here, and they decided that Sylvia would benefit from Bill giving her a call every week to check in on how her blood sugars were. This, too, was put into her care plan. And finally, one of our social workers, Julie, was helping Sylvia find rides to her future appointments. This, too, then was placed into her care plan. And you can see here, all these interactions are now captured in one place, a go-to place where people can know what's going on with Sylvia at any given time and help her get the care that she needs. This care plan has had large impact on Sylvia and other patients' lives. In addition, it's helped our team members work together and know how to listen and to meet our patients' goals. Throughout this process, 2 medical students, Lisa and Suhavi, were very crucial players in being part of our team, in treating chronic disease, and knowing that it takes implementing one solution at a time to treat the epidemic. Our care team members also enjoyed using the care plan platform.
With the care plan, I get a bird's eye view of patient's care, rather than just having tunnel view of just my role.
Using the care plan really made us communicate as a team.
This takes us to where we are now. Our electronic patient-centered care plan platform continues to evolve as part of the necessary emergency response to the growing crisis of diabetes and chronic disease. At the same time, it can be a model for how we can treat our complex patients and other types of chronic disease. Thank you.